When looking in healthcare, lots of things can cause disparities. One of those things being disability status, and this can really affect how people experience healthcare. One of the biggest issues with disabilities is communication between patient and provider. Sometimes providers do not adjust the way they talk and don't use interpreters or tools, and they can even just talk to the caregiver and not even acknowledge the person with the disability. And this can lead to confusion, mistakes, and cause worse care overall, and this is just far from what we want. There's also an issue of respect. Patients with disabilities are sometimes taken less seriously and not included in decisions about their own care, which connects to what we kind of learned about patient-centered healthcare. On top of that, there are some bigger issues like inaccessible equipment and policies that don't consider the needs of the disabled. Just like we talked about, some of these issues are built into the system and not just the individual doctors. Like our classroom, for example, how there are stairs and the disabled desk is all the way at the bottom of the classroom, but there's no ramp to get to said desk. So there's no way for someone in a wheelchair to be able to get down there. And that's just how the classroom is built. And that's an issue because now the person who needs that desk cannot access that desk. A good example of this is in the MedStar Law lawsuit when they didn't allow people with disabilities to bring in their caregivers or support people, which made it really hard for communication, and it made it really hard for everybody to understand what was going on, so were not getting the equal care. To fix this, healthcare needs better communication and more training for providers and policies that actually support the patient needs. Overall, it's about making care more accessible, respectful, and fair to everyone. And this